Okay, good evening, everyone. Thank you for attending our teaching session this evening. Today, we will have a short talk about stroke. Will be presented by Dr. Moustafa Barakat. This session is recorded and the feedback form will be, as usually, distributed with the recording after the session, hopefully today, inshallah. And the microphone up to Dr. Mustafa, whenever you're ready.
Hello everyone, this is Dr. Moustafa Barakat. I will give you just a brief introduction about myself at the beginning. My specialty is neurology actually, and currently I'm holding the position of internal medicine fellow at a tertiary hospital in Egypt, right? So today, thank you, Dr. Mohsen, for having me today. I'm gonna just give you just a brief introduction about stroke, just magnifying its significance as emergency case. I can be sure that all of us have met some patient with stroke at his point or at some point of his career, right? It will just take about 15 to 20 minutes, so I will not take so long, right? So let's begin. So stroke. First of all, we'll talk about the subject from multiple points of view, or let's say multiple aspects. The definitions, the symptoms, the diagnosis, and of course, the management. So let's begin with the definition, right? So it's called, also another name for the stroke is cerebrovascular accident. So from the name, cerebro means the brain, vascular means the blood. So it occurs when there's an interruption in the blood supply to the brain, leading to brain cell damage. From this area, it's significant as an emergency condition. Yes, because the brain cell death is, of course, an emergency condition. That's why we need to know about the types of stroke. We have, let's say we have three types, but let's magnify two types as they are the majority of strokes, and one mini type, right? So what is the first type? Of course, it is the ischemic stroke. Ischemic stroke is caused by when there's, let's say, a blockage or a clot in the blood vessel. This, of course, will affect the blood supply to the brain, causing the brain cell death. We have talked just about it, right? Ischemic stroke, what's common is common. So it's almost 87% of all strokes. Okay, ischemic stroke itself contains subtypes. We have two types actually, thrombotic stroke and embolic stroke, right? So what is the difference? Thrombotic stroke, it's caused by a blood clot forming an artery in the blood supply to the brain, all right? What about the embolic stroke? It's a clot also, but elsewhere, like anywhere else other than the blood supply to the brain. Let's say, for example, emboli coming from atrial fibrillation in the heart. That is the embolic stroke. Okay, these are the subtypes of ischemic stroke. About the treatment of ischemic stroke, we'll leave it now, but we will discuss now the other type of stroke, which is hemorrhagic stroke. All right. So what's hemorrhagic stroke? As we said before, it's interruption also in the blood supply to the brain, but this time it's bleeding. So it's bleeding within the brain, in the blood vessel in the brain, right? So I said before that ischemic stroke accounts for maybe 87% of stroke. So hemorrhagic strokes takes the rest, which is the 13% of stroke, right? Okay. As we discussed before that ischemic stroke has subtypes, also the hemorrhagic stroke having subtypes, all right? So we have, let's say, also two types, intracerebral hemorrhage and subarachnoid hemorrhage. Of course, we all know what intracerebral hemorrhage is, bleeding inside the brain, within the brain, right? And subarachnoid hemorrhage is bleeding between the brain and surrounding membranes, right? Excuse me if I'm going so fast, if I'm not making any sense or I'm not making clear voice or sound or anything, please stop me and let me know. Okay. We discussed the two major stroke types, the ischemic stroke and the hemorrhagic stroke. And we said it's almost 100% of stroke as a stroke. But this type, we can classify it as a stroke, but it's not a stroke. We'll let you know how is that. It's called transient ischemic attack. So what is the difference between transient ischemic attack and stroke? It's transient ischemic attack, as I told you, it's a mini stroke. The difference is it is maybe the same symptoms, but it resolves within 24 hours only. So stroke, it's temporary stroke, right? Temporary disruption in the blood flow to the brain, right? But it's very, very, very serious. We need to take it as serious as a stroke, because it could be a warning sign of stroke. Actually, as we're gonna discuss next, one of the risk factors of stroke is history of TIA. Right? Okay. That takes us to risk factors. We have already discussed the definition and the types. Comes the risk factors. Right? Number one in risk factors, the high blood pressure. Of course, hypertension is almost a risk factor for any medical condition. That's why high blood pressure needs to be strictly controlled, right? What else? Of course, is smoking. We all know it. We need to discuss more. Diabetes as well. High cholesterol. All these symptoms might cause atherosclerosis. Atherosclerosis may affect the blood supply to the brain, hence a stroke. It is just like a loop. One risk factor causing a condition, this condition causing a condition, and it goes like that. What else? Family history of strokes itself. Yes. What else? Age. Unfortunately, the risk increases with age, so it's expected in higher age groups. What else? Yes, that's what I was just talking about. Previous history of TIA. Right. And of course, obesity. As you can see, all of these risk factors, like it's known from history. Like that's why history taking is so crucial in stroke. Actually, history taking is so crucial in diagnosis and management of all medical condition, but it's so crucial, so crucial in stroke. All right. So we know about the definition, we know about the types, we know about the risk factors. Okay, so doctor, how can I know that my patient is suffering from a stroke? We have in neurology this acronym. It makes our life easier, all right? So what is this acronym? It's called FAST, F-A-S-T. So what is F? F for face dropping. Your patient might say, doctor, like my right face, it's numbing, doctor. Or you can see that his right face is dropping. That's why you can know that he has face dropping, which is F from the FAST acronym. Comes to next one is A. What's A? Arm weakness, of course. It's weakness in his arm or numbness. It may occur in one arm, though it might cause it difficult to raise both arms. But of course, when you meet the patient in the let's say emergency department, doctor will tell you that, doctor, I can't raise my arm, doctor. Doctor, I can't raise my leg, doctor. Okay, maybe he exactly will say, for example, I can't raise my right arm, doctor, but he can find it difficult to raise the other arm as well, but he will be able to raise it, right? To raise it, sorry. Okay. Speech difficulty. Yes, it's a S. S for speech difficulty. His speech might become slurred or even incomprehensible. You will not be able to understand him well. You might be able to understand him, but it's not his usual. So when he comes to talk to you, when you start taking history, you might find it a little bit difficult to hear from him because he has like this loud speech. All right. So all of this, the F, the S, the T takes us, the F, the A, the S takes us to the T. Whenever you found the FAS, do the T. What is T? Time to call emergency. Okay, let me magnify the importance of time in stroke. Right? Once you suspected stroke, you need to act as soon as possible, because we have this thing called time window. If we could give the patient the proper treatment in this time window, we could save his life. Right? We can save him even from a lifelong disability. Yes, that's why time is crucial in strokes. Yes. So once you suspect a stroke, call emergency. All right. This is about the symptoms. Okay. So, doctor, how to diagnose a stroke? Obviously, as I said before, number one in diagnosis is the medical history and physical examination. All right. You will need to start by taking a detailed medical history. The symptom, you need to ask about the symptoms we have already discussed, the risk factor as told, and various medical conditions. Right? Then you will do the physical examination. You will check his weakness, you check his numbness, any changes in speech, any neurological deficits, any lateralization signs, anything. You will do a full neurological and general examination. Okay, this is step number one. What's step number two? Imaging. So we'll always start with the history taking, then the imaging tests. Okay. Number one, of course, CT. CT is the first imaging test used to diagnose stroke. Why is this? Because CT can differentiate between the hemorrhagic stroke and the ischemic stroke. That's why we need to do the CT as a beginning, right? Okay. So there's one thing that patient might be unfortunate about, that ischemic stroke might not be appear in the CT in the first 48 hours. So what to do now? Let's take to another steps, which is the MRI. MRI provides more detailed image of the brain, and it causes more visualizations of the affected area. Hence, it can identify the ischemic changes if there's ischemia. If there's hemorrhage, CT will mostly CT will catch it, right? There's one more thing we can do it in hemorrhagic stroke. I didn't write it here, but we can say it anyway. It's lumbar puncture, right? Lumbar puncture, we can take a CSF sample if we found what's called vansochromia. As vansochromia is yellowish discoloration of the CSF. It is due to bilirubin and hemoglobin in the. It's when they are degraded, extracted. I mean, they can be found in the CSF. We might suspect at that time this is hemorrhagic stroke. All right. Okay. So we said about the CT. We said about the MRI. Also, this is the MRA, which also help us to visualize the blood vessel and the blood supply to the brain. If there's any blockage or any abnormalities, it may catch it. Okay. So the physical examination and history taking done. The imaging done. Okay, what's next? Obviously, the blood test. All right. So what are the blood tests? It is just like general blood tests like CBC, coagulation profile, lipid profile, and of course blood glucose level, just to make sure that, okay, patient might just be hypoglycemic. Yes, that's why we need to check the blood glucose level. He might come with these symptoms that he's confused and blah, blah, blah. And eventually, we might find him hypoglycemic. Yes. Of course, any confused patient will follow the approach ABCDE assessment, but we're not here talking about that, right? Okay. Yes. That's what I was talking about recently. Time of onset and time window. All right. So what I wrote that determining the time of stroke onset is crucial, a certain treatment, such as thrombolytic therapy, have a specific time window within which they are most effective. Yes. The time window is about 4.5 to 6 hours from the start of symptoms. Yes. Not from the time he came to the hospital, or not from the time, maybe from the time that his wife, let's say, for example, his wife noticed it, or even the patient was asleep and when he wake up, he found these symptoms. Unfortunately, we can't determine the time at this case. So let's make sure that when you take history, you take proper history, you ask about the time of onset of symptoms. All right. Yes, and this was what's written in the next point. The healthcare provider will gather information from the patient, witnesses, or available medical records to establish the approximate time of symptoms onset. All right? Okay. Treatment options. Okay. Okay, as we said before, we discussed already the definition, the type, the symptoms. So we have different types. So of course we have different treatment options, all right? But let's not shortcut like, let's not say just it is treatment. It's not treatment, it is management. We all know the difference between management and treatment, because management is a wider word. Like, it includes the treatment, it means treat the condition, but management, you will manage the condition and what comes after. That's why we'll start with the treatment of the condition now, and we'll talk about what comes afterwards, right? So ischemic stroke treatment. Ischemic stroke treatment. If the patient coming in the window phase, we'll start with the TPA, tissue plasminogen activator. It's a medication that can be administered within a few hours of symptoms to dissolve the blood clot. Very, very, very high percentage of succeeding, right? Okay, this is ischemic stroke. There's also a mechanism, or let's say procedure, called mechanical thrombectomy. It's a procedure, it involves the use of specialized tool to remove the blood clot from the blood artery, okay? It's also effective if used within a certain time, okay? So these are the two options of ischemic stroke treatment, TPA and the mechanical thrombectomy, okay? What about the hemorrhagic stroke treatment? There is a medication treatment, which is treatment might control the blood pressure and prevent seizure. Some prefer to use calcium channel blockers, nifedipine, for example, stuff like that. Also, there's this surgical intervention, okay? Surgical interventions, it is depending on the cause and location of the bleeding, right? We might do, not also, I'm a neurologist, but this is a neurosurgery area. They might do clipping or coiling or even coiling of the aneurysm. Or if there's any arteriovenous malformation, they can even remove it or detach it, right? Yes. So this is about the hemorrhagic stroke treatment. So we talked about the ischemic stroke treatment and the hemorrhagic stroke treatment. Okay. What comes after? Supportive care and monitoring. Stroke patient might require close monitoring in a specialized stroke unit. Most of the big hospitals have a stroke unit in it, right? Or even the ICU. Okay, you need to measure, you need to assess his vitals regularly, like by taking his blood oxygen, blood pressure, and of course temperature, everything about his vitals. Okay, and if there's any complication like brain swelling, infection, anything, you need to treat. All right. Okay. What's next? The rehabilitation. Yes. Okay. What we all discussed, what we all aspire in treating any condition is to improve the quality of life. All right. So, patient of strokes might cause stroke. Unfortunately, might cause disability, but will not let the patient live with his disability without interfering. We need to do something about it. That is comes the importance of rehabilitation. Okay, so we have multiple area affected. The speech is affected, the movement is affected, and of course the inner sensation, or let's say his psychological side. I mean, right? So we'll start with the physical therapy. We'll mostly will refer patient to physiotherapy, just to focus on improving the strength and movement of different limb affected, right? Also, the occupational therapy will help to adjust his household. Like, I mean, if there's stairs at home or anything, he need to do adjustment at home, anything like that. Will at this time we'll need to interfere with occupational therapy. Yes, we'll need to involve them. Okay. Speech therapy, as I said, patient may become slurred, or even his speech may be incomprehensible. That's why we need to address the speech therapist. He will address if it says any language difficulties, any swallowing problem, and of course the speech impairment, right? And psychological support. If patient needs to be referred to psychologist for support, we will do it. For any counseling, any group therapy, any behavioral, any CBT, anything will involve the psychologist. Okay, for this is rehabilitation. Okay. Okay, so I already mentioned in the risk factors that previous stroke in itself is a risk factor for upcoming strokes. That's why we need to do the secondary prevention. We need to do lifestyle modification. Okay, so we need to put the patient on treatment like antiplatelet drugs like aspirin, anticoagulant, cholesterol lowering drugs like statins, and of course medication to control his blood pressure, right? So also the lifestyle modification, we need to encourage the patient to a healthy lifestyle, maybe regular exercise, balanced diet, smoking cessation. We might need to refer him to a smoking cessation clinic if he's willing to, and if he needs to stop alcohol or anything, we might need to refer to the alcohol and misuse clinic if he needs to. All of these are risk factors. So all of this might help us to reduce the risk of recurrent strokes. Yes. Okay. So to find more information about strokes, you can visit the American Stroke Association, National Stroke Association, CDC, World Stroke Organization, and Mayo Clinic site. I'm so thankful for you to having me today. I'm sorry if I didn't make I wasn't clear at any point, and thank you.
Thank you very much, Dr. Moustafa, for this very informative and nice approach and summary for stroke.
Thank you.
Anybody wants to ask Dr. Moustafa any question before we close, or any comments? I'll take it as a no. Okay, guys. Thank you, Dr. Moustafa, for being with us this evening and for the nice presentation. And thank you everybody for attending. And as I mentioned earlier, the feedback form will be posted on the group hopefully today, with a recording as well. Okay, thanks again for attending, and I hope we'll see you again with us next week.
Thank you.
Well, thank you very much. See you later.
Bye.
Bye. Assalamu alaikum.
Thanks.